Jugular venous outflow disturbance, or JVOD, is a condition that affects the veins in the neck. These veins, known as the jugular veins, are responsible for draining blood from the head and brain back to the heart. When there's a disturbance in this outflow, it can lead to a range of symptoms and complications. JVOD is an area of growing interest in medical research. Its implications for various neurological and vascular conditions are being increasingly recognized. Understanding JVOD is crucial for effective diagnosis and treatment, potentially improving patient outcomes. In 2018, Joe and colleagues published a paper titled "Understanding Jugular Venous Outflow Disturbance." This paper provides valuable insights into the causes, diagnostic approaches, and treatment options for JVOD. And one of the key strengths of Joe et al.'s work is the use of illustrative diagrams. These diagrams help simplify complex medical concepts, making them easier to grasp for both healthcare professionals and patients alike. Figure 1 in Joe et al.'s paper provides a visual representation of the various factors that can contribute to JVOD. These factors are categorized into two main groups, intraluminal and extraluminal. Intraluminal factors refer to issues within the vein itself. For instance, the presence of a blood clot, a membrane-like structure, or an elongated venous valve can obstruct blood flow, leading to JVOD. Extraluminal factors, on the other hand, originate from outside the vein. An enlarged thyroid gland, for example, can compress the jugular vein from the outside. Similarly, adjacent arteries or bony structures like those found between the styloid process and the first cervical vertebra can also cause compression. Understanding these different etiologies is crucial for determining the most appropriate treatment approach. For example, a blockage caused by a blood clot may require blood thinners, while compression from an enlarged thyroid might necessitate surgery. Figure 2 in Joe et al. As research delves into the world of neuroimaging, it showcases examples of how JVOD manifests in medical imaging, specifically magnetic resonance phonography and three-dimensional computed tomography reconstruction. The figure presents images of patients with bilateral internal jugular vein stenosis, meaning a narrowing of the internal jugular vein on both sides of the neck. In the MRV images, this stenosis is evident as constricted areas in the veins, indicated by short arrows. A striking observation in these images is the presence of prominent tortuous collateral veins. These veins develop as a compensatory mechanism. When the main jugular veins are narrowed, the body tries to maintain blood flow by rerouting it through smaller, alternative pathways. The three-dimensional CT reconstruction images provide another perspective on JVOD. These images suggest that the internal jugular vein stenosis in these patients is likely due to compression from nearby arteries. This highlights the importance of considering anatomical relationships when diagnosing JVOD. Catheter venography is a minimally invasive procedure that allows doctors to visualize the veins and assess blood flow. Figure 3 in Joe et al.'s paper presents a compelling case of unilateral internal jugular vein stenosis, meaning the narrowing affects only one side. Image A shows the pre-stenting condition. A catheter is inserted into the vein and a contrast dye is injected. This dye makes the vein visible on X-ray. The blue arrow points to a severe stenosis in the right internal jugular vein. Additionally, the red arrows highlight the extensive development of collateral veins, again demonstrating the body's attempt to circumvent the obstruction. Image B reveals the post-stenting result. Stenting involves inserting a small mesh-like tube into the narrowed vein to prop it open and restore blood flow. As evident in the image, the stenting procedure successfully recanalized the internal jugular vein lumen. Remarkably, the collateral veins are significantly reduced in size after stenting. This underscores the effectiveness of stenting in not only treating the stenosis, but also alleviating the need for collateral circulation. Section 5, Complications and Resolution, Figure 4 in focus. Left untreated, JVOD can lead to various complications. One such complication is papilledema, a condition characterized by swelling of the optic disc, the point where the optic nerve enters the eye. Figure 4 in Joe et al.'s paper illustrates this complication and its resolution after treatment. Images A and B showcase the fundus photographs and optical coherence tomography. or OCT, scans of a patient with bilateral IJV stenosis before stenting. The fundus photographs reveal severe papilledema in both eyes. The optic discs are elevated and surrounded by a peripapillary halo indicating swelling. The OCT scans provide a cross-sectional view of the retina, the light-sensitive layer at the back of the eye. In this patient, the OCT shows vessel congestion and tortuosity, further confirming impaired blood flow. Moreover, there's an increase in the thickness of the retinal nerve fiber layer, a hallmark of papilledema. Images C and D capture the same patient's eyes 15 months after undergoing stenting. The transformation is remarkable. The papilledema has significantly improved, the vessel tortuosity has resolved, and the optic discs appear much healthier. Section 6. Diagnosis and treatment of JVOD. Diagnosing JVOD typically involves a combination of physical examination, patient history, and imaging studies. Doctors may suspect JVOD based on symptoms such as headaches, dizziness, visual disturbances, or swelling in the neck. Imaging techniques play a crucial role in confirming the diagnosis and identifying the underlying cause. Ultrasound, Connecticut scans, MRV, and catheter venography are commonly employed to visualize the jugular veins and assess blood flow. Treatment for JVOD depends on the underlying cause and the severity of the condition. In some cases, conservative management with medications may be sufficient. Blood thinners, for example, can help dissolve blood clots, while diuretics can reduce fluid buildup and pressure. In other cases, more invasive procedures may be necessary. Stenting, as demonstrated in Figure 3, is a minimally invasive option for opening up narrowed veins. In more severe cases, surgery may be required to address anatomical abnormalities or remove blockages.